Good morning. Welcome to Block 8 of the Physician Communication Curriculum. I'm Dr. Sadia Ghazi, Lead Educator in Physician Communication here at Loyola. Block 8, we will be discussing Teachback. What is Teachback? Teachback is a technique for healthcare providers, a way to ensure that they have explained medical information clearly to their patients, and a way for patients and their families to understand what has been communicated to them. Multiple studies have shown that the teach-back method is simple and feasible in contributing to safer and better transitional care from the hospital at time of discharge. Teach-back allows the increased likelihood of full knowledge retention for patients. Teach-back involves the physician explaining information to their patient, then assessing how much their patient has understood, and then clarifying any points the patient may not have understood. Continuous cycle of assessing and clarifying, then assessing and clarifying continues on until the patient has full understanding. This cycle of assessing and clarifying requires the physician and the patient to have dialogue. Recall the previous presentation in Block 7, where we talked about how we change monologue to dialogue. How do we do this? We can use the ART method, ask, respond, tell. Let's review. A stands for ask, R for respond, T for tell your perspective. You can use the ART cycles to create loops in which you change your monologue into dialogue. So, what questions can I ask to get the ART loop started for Teachback? Here are some examples. Ask your patient, can you tell me in your own words what we've decided on so that I know I did a good job explaining? Another example, when you speak with your family member, what will you tell them we discussed? Recall the sample monologue to dialogue we used in the previous education block. What do you know about the infection you have?
I think you told me I have an infection on my skin.
Correct. You have what we call cellulitis. That's an infection of the skin. We need to treat you with antibiotics. Have you ever used Keflex before?
I think I've heard of it before.
Great. You're going to take that 4 times a day. Now remember, it's very important to follow the directions when you take these medicines. If you don't, the infection might get worse. I want to talk to you about your wound care. Have you been able to see how the nurses change your wound dressing?
Yeah, I have. They have been changing it every day.
That's right. You need to continue changing the dressing every day at home. We're going to send a nurse to your home to help you with this. I believe your primary care physician is Dr. Ma. Is that right?
Yes, you have been seeing her for many years.
Awesome. I need to make sure you see Dr. Ma in the next 1 to 2 weeks to make sure your wound is healing the right way. Now, let's add on some teachback. Let's utilize the sample questions we used to initiate an ART loop. All right, so I want to make sure I did a good job explaining everything to you correctly. Tell me, when your family comes to pick you up, what are you going to tell them we talked about?
So I need to take the antibiotics, I need to do wound care at home, and a nurse is gonna come to my house to help me.
Amazing. You are missing one more thing. I need to make sure you make an appointment with your primary, Dr. Ma. What other questions do you have for me?
Nothing else, Doc. I think I've understood everything.
Great. You will have written instructions too, in case you forget. Please read those carefully. Remember, teach-back requires you to make sure that your patients have clear understanding of their discharge instructions. By starting with a simple question, you can initiate art loops to assess and clarify, and again, assess and clarify until your patient has shown complete understanding. Good luck this month as you test out your teach-back skills.